What is an aneurysm in the heart? A heart aneurysm, often called a ventricular aneurysm, is a localized balloon-like bulge in the muscular wall of the heart. It most commonly develops in the wall of the left ventricle following a heart attack, causing the thinned muscle to stretch and bulge outwards with every heartbeat. Key types. There's ventricular aneurysms, which are the most common type. It forms in one of the lower pumping chambers, ventricles, after a myocardial infarction, which is a heart attack, damages the heart tissue, including a thin, scarred, and weakened section of the wall. Aortic aneurysm. Often associated with the heart, this is a bulge in the aorta, which is the massive main artery that carries blood directly out of the heart. These occur when the artery's walls weaken under blood pressure and can occur in the chest, thoracic, or stomach, abdominal. So that's the picture that we have right here, the aortic aneurysm. Coronary artery aneurysm is a rare ballooning of the blood vessels that supply oxygen to the heart muscle itself, frequently associated with conditions like Kawasaki disease. If a clot breaks loose, it can travel to the brain, causing a stroke or other parts of the body. Heart failure. The heart has to pump harder because the ballooning section wastes some of the heart's pumping energy, which can lead to fatigue, shortness of breath, and fluid buildup. Arrhythmias. Scarring and altered electrical pathways in and around the aneurysm can cause dangerous irregular heartbeats. Common causes. Prior heart attacks. The most frequent cause, damaged and scarred heart muscle loses its elasticity and stretches over time. High blood pressure. Chronic high blood pressure puts immense stress on artery walls and the heart muscle. Atherosclerosis, a buildup of fatty plaque that narrows arteries and weakens vessel walls. Infections or inflammation, conditions that attack the heart lining or artery walls. Genetics and connective tissue disorders, conditions like Marfan syndrome can make the walls of the heart and aorta abnormally weak. Symptoms. Many aneurysms develop silently and produce no symptoms early on. However, as they progress, patients may experience chest pains, shortness of breath, palpitations, or fainting. If you want to dive deeper into the treatment options like monitoring, medication, or surgical repair, or if you're tracking specific risk factors, consult the American Heart Association for comprehensive resources. Okay, so an aortic aneurysm is a bulge in the wall of your aorta, which is what you see here in the picture, the main artery from your heart. Aortic aneurysms form in a weak area in your artery wall. Okay. The bulge in a blood vessel caused by weakened atrial walls that no longer stand up to the pressure of pumping blood. Arteries carry oxygen, rich blood from the heart to the rest of the body. So if you want to learn more about what's going on with your heart, the aortic muscle, the aneurysms, look at the American Heart Association. If you're someone that has high blood pressure or low blood pressure, prior heart attacks, atherosclerosis, infections or inflammation, genetics, and connective tissue disorders, which are common causes. Reach out to your doctor and learn more about it.